Hello and good morning. I'm Jennifer Wexton. Thank you so much to everybody joining us this Saturday morning for my town hall on COVID-19 in Virginia 10 and a little brief update on COVID relief negotiations going on up on the Hill. I am so honored to be joined today by Dr. Gloria Addo-Ayensu, who is the director of Fairfax County's Health Department, who is an expert in everything that's going on and is going to be able to answer so many of your questions this morning. Before we get started, I just do want to have a little bit increases in levels of cases and hospitalizations across Virginia 10. No part of the district is immune, from the Shenandoah Valley all the way into the DC suburbs. I spoke with my local health department directors and officials from the local hospital systems recently, and they are all experiencing increases in cases. So now is definitely the time to step up our vigilance, continue masking, continue social distancing, get tested if you've been exposed. I mean, all the things that we all know. But there is light at the end of the tunnel, as I'm sure you've all have heard. Vaccines are on the way. 2 now have been approved. 1 has already been deployed. The first Virginians were vaccinated earlier this week, and more every single day with our frontline healthcare workers who have been fighting so valiantly through this entire pandemic. So this is very encouraging, and we've all been waiting for it for a long time, but we're still not out of the clear. We're still not in the clear. We're going to have to all remain vigilant during the holidays. I know it's hard. I know that we had another town hall where I was talking about Thanksgiving. We're going to have to do it again during Christmas this year and New Year's. But, there is light at the end of the tunnel. So the CDC has recommended that you stay at home with your family that you live with anyway. And this is how you're going to stop the spread and stop, and protect your loved ones. So I know that it stinks. I know it's not what we want, but there is light at the end of the tunnel. Now, on the Hill, we've been very busy. We have been negotiating for COVID relief package for many, many months, and now we are at the 11th hour because so many programs are expiring at the end of this month. Now, we did pass legislation to extend the funding of the federal government through Sunday night. So we're hoping that we'll be able to roll a COVID relief package into that. There's been negotiations on a bipartisan COVID compromise bill, which would include additional small business assistance, more funding for testing and vaccine deployment, funding for schools, funding for transportation, and another round of extended enhanced unemployment benefits. So gig workers and those who might not be eligible otherwise will be protected, as well as that enhanced benefit, probably $300 per week, as well as another round of direct stimulus payments. They're talking about $600. That is completely inadequate, but we're viewing this kind of as a down payment because we're not going to be able to do as much as we want. Obviously, I think that $1,200 is the minimum it should be, but there's not a lot of agreement across the aisle on that. So we need to make sure that we get what we can while we can. We're not going to break for the holidays until we have some sort of relief out to people who are desperately hurting and small businesses who are hanging by a thread. And we realize that so many of these programs, including the eviction moratorium, expires at the end of this year. And we need to make sure that those programs are extended at least into the new administration. So as always, my office remains open for anybody who needs help. You can reach us by phone or at wexton.house.gov. If you have a question that we don't get to today, or if you have issues with some sort of public benefit or questions about anything, please do not hesitate to contact us because we are very happy to help and connect you with anybody who might be able to assist you. Now I'd like to turn it over to Dr. Addo-Ayensu for a brief introduction about what's going on with the health department. I know she's been super busy, so if she can talk a little bit about what's been going on with her before we get started with our discussion. Dr. Addo-Ayensu, please take it away.
Thank you so much. And good morning, everybody. And it's a pleasure being here, part of this conversation. As we all know, the Northern Virginia region, like other regions across the country, is also seeing a surge in new COVID-19 cases and hospitalizations. There is widespread community transmission, which unfortunately will worsen as friends and families come together to celebrate the holidays. unless we actually commit to practicing the community mitigation public health messages that we've heard over and over again. I think that what we need to do a little bit more as time has gone on, we've become a little fatigued, but ever more so, this is a time where we have to be vigilant and remind each other when we're around our loved ones and our friends, if we are slacking, that we continue to maintain the 6 feet social distancing, to wear our masks at all times, the frequent hand washing, and so on and so forth. You are correct in your assessment when you say that there is light at the end of the tunnel. We finally have something, an additional tool in our mitigation efforts to fight this pandemic virus. They are the two mRNA vaccines that have been recently authorized, the Pfizer and the Moderna. As you correctly spoke about, Virginia has already received about 70,000 of those vaccines already, and they're expecting to receive roughly 400,000 or so for healthcare personnel and long-term care facility residents. So there are a number of things going on to make sure that happens. And while that continues, because we're not going to have enough vaccine for everyone to, at the outset, we still have to remember to do those mitigation measures that we've talked about so much. It's critical right now because it's flu season, it's cold, it's a holiday season, we're congregating. It's just a perfect storm. There's so many factors that enough them by itself will propagate the transmission of the flu, sorry, of COVID viruses as well as flu viruses. And coming together, if we're not careful, we will see a significant rise in numbers, which could overwhelm our healthcare system, and then it will be, make it challenging for our healthcare personnel to treat the individuals who are in hospital, give them all the options, the treatment options that is available. So
And
with that,
it actually leads me to a question, because I know that you're on the ground and you see what's happening with our hospital systems. And I know that we're all hearing on the news about California being stressed to the max and not having any ICU beds left, and other states really suffering. I know that in Virginia, we're not there yet.
correct.
But can you speak about what you're seeing in terms of in the hospital systems about bed availability, and is that really the stress point? Because my understanding is it's less about the beds that are and ventilators that are available than it is about the staff being overworked and attrition in the for nurses and respiratory techs and things like that. So can you talk a little bit about what you're seeing here in Virginia and where we
So
are?
I think in Virginia as well as everywhere, it is a confluence of all of those things. So even if you had ample ICU beds and ventilators, but you don't have enough staff, that doesn't work either, because people who are sick with COVID and require hospitalization tend to be very sick, and it's it's an intense the intensity of care is what is required to get them successfully on their feet. So the nice thing about what's happening now with the vaccines is that the first allotment of vaccines is being it's being targeted to our healthcare personnel in hospital settings, in long-term care facilities, and in private hospitals, private offices, and so on, dialysis units, our home health care, the entire spectrum of people who actually are front facing with people who are ill in our healthcare system. So that's why we're encouraging that. We also are encouraging flu vaccines uptake because there are flu viruses that are circulating, and if we can protect ourselves from that, that decreases the chance of us getting ill from the flu. If we get vaccinated with the COVID vaccine, that also lends another layer of protection. And then when we, as a community, do all those things that we've talked about over and over again, the community mitigation measures, that then limits the number of people who are sick and pass on the virus, and that limits a number of people then who might become hospitalized and require that extensive care that we get in the hospital setting.
Wearing a mask around others, that definitely helps. So, Dr. Addo-Ayensu, one of the things that you mentioned is that vaccinations are already happening in Virginia for those frontline workers. Can you explain what the next steps are with the vaccine rollout and what process your department is taking to help vaccinate people to get Virginians vaccinated who may not be frontline healthcare workers or living in long-term care facilities, those next tiers of people?
That's correct. So right now, the vaccine that's available is geared towards 1A. So we're in phase 1A, and the people in phase 1A are the ones that I mentioned around the long-term healthcare personnel and residents of long-term care facilities. In terms of the long-term care facilities, they'll be receiving their vaccinations for their residents and staff from CVS and Walgreens through a federal program that is currently being rolled out. As we said, hospitals have received their initial doses of vaccine. They've begun vaccinating their staff and healthcare workers who are affiliated with their hospital. However, for other healthcare workers who are in phase 1A that are not affiliated with the hospital, so I'm talking about places, healthcare workers who work in, let's say, dialysis centers or home health, dentists, our community physicians, for those people, local health departments will distribute the vaccine to them through points of dispensing that we are gearing up to operate in partnership with our Medical Reserve Corps volunteers and our county partners. Similar to what we did for those of you who remember the H1N1 vaccination clinics. So our health department, Fairfax County Health Department, we've begun reaching out to these healthcare workers in the 1A category. We are booking appointments starting December 28th. We expect to receive an initial quantities of vaccine sometime next week. And if our shipment arrives before the Christmas break, then we will, in addition to what we are planning to do starting the 28th in our dispensing sites, we will also vaccinate phase 1A employees who are Fairfax County employees. So like Fairfax County Fire and Rescue, EMS, the Fairfax City EMS, because although we are the Fairfax County Health Department, we serve the cities of Falls Church and Fairfax, as well as the towns of Vienna and Herndon. So we'll be doing the EMS. Also the Community Services Board, the CSB has healthcare workers who are part of the 1A. Our detention centers have people who are healthcare workers in the 1A category, our federally qualified health centers, as well as people within our own health department. So that's our plan for the initial phase 1A vaccination program. And the 400 or so thousand vaccines that the Virginia Department of Health will be receiving is basically for this phase 1A category. The ACIP, the Advisory Council on Immunization Practices, has not yet firmed up what the next category of people who will be receiving vaccine is. But there is talk about, and so that's going to be the 1B group. And so right now, the kinds of essential workers that are being considered are people in the education sector, the food and agriculture sector, utilities, police, firefighters, and so on, people in transportation business and so on. But that category of people who will be vaccinated in that next phase has not been firmed up as yet. And then after that will be people in phase 1C, which are adults with high-risk medical conditions, those underlying medical conditions that we've heard about, which have predisposed some within our community to have more serious complications from COVID. So it's that group of people with, diabetes, hypertension, obesity, chronic diseases, those kinds of groups, as well as adults older than 65 years. So that's the first three major groups of people that will be vaccinated. It is estimated that entire, from 1A, 1B, and 1C, that entire group constitutes about 160 to 180,000 Americans. And then after that,
160, 180 million.
Sorry, million,
Okay.
not thousand.
Yeah.
Thank you for catching that. 160 to 180 million Americans. And
Okay.
and then after that, probably heading into the summer, we expect to have sufficient vaccines for everyone else who is interested. And at that point, vaccines will be available in, your doctor's office, your pharmacy, just like how we've been having vaccine available during flu season. It'll be that widespread. But
So
between now and
1A and 1B are based basically on your profession, more, what you're doing to be out in the community. And then 1C is on your status as a senior citizen or as somebody with a pre-existing condition. Is that right?
is correct. That is correct.
Okay. And have they decided, because if you start out on the Pfizer vaccine, as so many of the people in 1A are going to be doing, then they have to have their second dose of the Pfizer vaccine in 21 days, or
That's
I think
correct.
it's 21 days for Pfizer and 28 for Moderna. So is the thought to have everybody in that 1A category get the Pfizer and then everybody in 1B get the Moderna, or have they not figured that out yet?
No, the goal is to get people to finish their vaccination series. But
Okay.
I don't. I think, again, a lot of this depends on vaccine availability, right? So if vaccine is being churned out at a rate that enables both to happen, then the plan will be to finish up the second dose, and to continue and then to start vaccinating the next groups of people. If the vaccines are not, for some reason, they're more limited. I would suspect that, and I don't know for a fact, but I would suspect, because it just makes more sense to finish a group that you have started, as opposed to just spreading thin. So, but
Right, because it would not be very helpful if we had a bunch of people who had some immune response, but not enough to really knock the virus down.
that's
So
correct.
and for those vaccines, like the Moderna doesn't have to be as in the same kind of cold storage as the Pfizer. Is that correct?
That is correct.
So
That
it
is
might be
correct.
easier to deploy that in some rural areas or places that maybe don't have the same kind of access to those cold storage facilities. Is that a good
That's
assessment?
correct. So the vaccine distribution will be done with that in mind. The setting in which the vaccine is going to. If you don't have ultra cold storage, then you will not be able to receive vaccine. But for example, local public health departments, hospitals, and so on that have that ultra cold storage can be recipients of vaccine, and other entities could come and get distributions from them at some point, if that were to be necessary. So it all depends. I think the beauty of this time around is that we have at least 2 vaccines now that have been authorized. There are others in the pipeline, and the variety, if the more different formulations that we have, the better we will be, because then we'll be able to match different vaccines for different settings, and make it more.
So I guess the timeline for all of this is evolving as more
That's correct.
vaccines hit the market and as we
Correct.
find out how it's being deployed. Okay, great. Well,
That's
that's
correct.
that, and I could ask you questions all hour, but I know we have some questions from viewers, so I'm going to toss it to Justin to take some questions from the audience.
Yeah, absolutely. Thanks so much to you both. So our first question comes from Rick from Fairfax, and Rick asks, how do you find out how to register for and get confirmed for a COVID test?
So I'll start with this one. I know that every local health department publicizes free testing events that are happening in their areas. I got a notice about one happening in Loudoun County where I live not too long ago. So my on my website, wexton.house.gov, has a COVID resource guide, which has links to each individual health department. So check your local listings. If you live in Fairfax, you want to check with them. If you live in Clark or Frederick, the Lord Fairfax Health District is where you would go. Dr. Addo-Ayensu, do you have anything else to add about that, about places where people can still get tests for free?
No, I agree with you. I think the best place to start is on the website. So on our website, and they can get to our website, I guess, through yours. But if they come to our website, in Fairfax County, we have over 50 sites where people can get a COVID test. And on our website, we list the places, the addresses, whether there is a fee that's charged or not, whether you need a doctor's referral or not. There's a lot of information there. And then they also, and also the addresses of these places, so people can choose the best place for them.
And are there places where they can make appointments, but they're also just first come, first serve events, for everybody just coming as they are? And
That's correct. So for these places, again, whether it's walk-in or not, it's also indicated on our website. We have a little table with all the different criteria that people typically want to know before they actually go out to make an appointment or so. Sometimes we also host community testing events, the health department, through our mobile lab. And these are not published. The places that we choose to go to are based on what the data shows hotspots within our community. So when we see, cases coming from a certain area, we work with local community partners there and our outreach team, and we go out there on a certain day with nurses and other staff from our health department. We have a mobile lab. Our health department is the only lab in the state of Virginia that has our own laboratory. So we go out with this mobile lab and we do testings in these communities. Sometimes we go back a second time, but we just chase the data to see where the hotspots are within our community and engage the community.
Go there.
Individuals to come and get tested.
Gotcha.
It's been very important. It's been very successful, that approach.
Great, thank you.
Our next question comes from Edmund from Brambleton, and Edmund asks, do you support President-elect Biden's proposed 100-day mask mandate, or do you think the Trump solution of a rapid vaccine is better?
So I don't know that the president-elect is really calling it a mandate. I think he's just asking everybody to do the right thing and wear a mask and really commit to that for 100 days. And I think that why can't we have both, right? Because if we combine the rapid deployment of these vaccines, which it sounds like is underway, with everybody doing, what we need to do to what we know stops the spread of COVID, then we'll get more bang for our buck, right? So you can't, while those vaccines get deployed, I don't think that 100 days is too much to ask for when there is this light at the tunnel. So I think, why not have both? That's my thinking. Do you have anything else that you want to add to that, Dr. Addo-Ayensu, or is there?
No, I think you really stated it very eloquently. The other thing about vaccination is that for us to achieve that critical mass that is needed for the COVID virus, the virus that causes COVID, to sort of not be able to cause these outbreaks, it's going to take us a while to get to that critical mass. That's what we call herd immunity. And it's thought that for us to reach herd immunity, we're talking about 70 to 80% of people in our community vaccinated. That's not going to happen until probably the fall, at best, the fall or winter of next year. So in the meantime, we are going to still need to do these non-pharmaceutical interventions that we've been talking about so far, the mask wearing, the hand washing, the social distancing, and so on. One of the things about the mask wearing is that in wearing a mask, so at first the guidance was that we should wear masks, but the rationale was because we wanted to protect others. So the thinking was that when I wear a mask, I'm actually protecting you, and when you wear a mask, you protect me. And then as time has gone on, we have realized that when I wear a mask, I protect you and protect me as well, and the same thing. And so, and why that is so is that when you are infected with COVID. So we know that a part of what happens when we speak is that we have these droplets that come and spew out of our mouths. When we sneeze, these droplets come out. And because they're heavy, they tend to drop within 6 feet, which is why we have the 6 feet social distancing, recommendation. When you're wearing a mask, when I wear a mask and I'm spewing out these droplets, the mask forms a barrier, so that basically stops a significant amount of these droplets from coming out. And for the ones that come out, if you are wearing a mask, your mask also stops it from reaching you. And why that is important is that we're beginning to understand that the amount of virus that you actually inhale is proportional to the severity of illness that you can actually have. Yes, and so as you've seen, as we have engaged with, as we've taken on the practice of wearing masks more and more, some of these scientists are beginning to explain the reason that we are not seeing as much hospitalizations for the amount of cases that we are seeing. So even though our cases are increasing, the hospitalizations and the deaths are not as much as in the beginning of the pandemic when we hadn't adopted these universal mask wearing. So the masks are very critical now during this rollout of the vaccine. And as the guidance also has says right now, even if you've gotten the vaccine, even if you've been vaccinated, it doesn't mean that you should stop these mitigation measures. We want you to still wear a mask, still practice a social distancing and so on, because it is possible, we just don't know yet, it is possible that the vaccine may not prevent you from acquiring COVID, but maybe it might actually help just reduce your symptoms and give you a much less illness, which if that is the case, you might be able to still shed virus. And if that is so, then it's important that you maintain your mask. So until we learn more about the effects of the virus, of the vaccine, the recommendation is to continue to use your mask and do all the things that we've been saying that people should do, even if you get your vaccine.
Gotcha. And you got to wear it over your mouth and your nose, people. I get it, because, I wear glasses most of the time and I know that it fogs them up, but this is the way that it works. You can't just put it over your mouth and leave your nose exposed.
No, you have to have the mask here. You have to make sure. And it's nice when you have the ones with a clip on here. Make sure that you clip it against your nose and make sure that your nose and your mouth are covered and nothing is able to slip around. So this is the best way.
Those clips help for sure. Great. Thank you. Justin, do we have any other questions?
We do. Our next question here, this is from Fran from Fairfax, and Fran asks, are the vaccines going to be available for older individuals with pre-existing conditions at CVS or other sites after nursing home residents? So they're asking sort of, where will people be able to go to get a vaccine?
So this is those 1C category people, right? Okay, I remember
That's
this
correct.
earlier in our conversation. So Dr. Addo-Ayensu, you touched on this a little bit. Can you answer it again for Fran?
So thank you for that question, Fran. At this time, vaccine is not available to 1C individuals, which are individuals with underlying medical conditions, as well as people 65 years and older, unless they are healthcare personnel. So, um, but in future, when we get more vaccine, it will be possible, and it will depend on how much vaccine is around when we get to 1C. But certainly, the health department, the local health department, will be in the business of providing vaccine through the vaccination clinics. The Fairfax County Health Department has plans to set up these vaccination opportunities in our 4 district offices. We have 5 district offices. We're going to be using 4 of them for vaccine dispensing during the week. And then on weekend, we hope we will be hosting vaccination clinics at our government center, similar to what we did with during H1N1, when we'd have mass vaccination clinics at the government center on weekends. And then during the week, because the government center is busy during the week, we would use our district offices to distribute vaccines that way.
Great, thank
Our
you.
our next question is another follow-up on vaccines from Bill from Oak Hill. And Bill asks, how and by who will we be notified when it's our turn to get the vaccine?
That's a great question. I was wondering this myself because it sounds like you're doing a lot of outreach, but are you going to be like, for example, if somebody has an underlying medical condition, are you going to notify their physicians and then their physicians notify them? I mean, how are you guys going to get the word out to people that it's their turn?
So we will obviously use media. One of the critical piece that I forgot to include in my response earlier is our community providers. Our community providers have been asked to sign up to receive vaccines. We worked with our community providers in the last months, and the majority of them have signed up to receive vaccines. So they will be receiving vaccines directly into their practices as well as vaccines become available. So people will have many options. They can go to their regular doctor to get the vaccine. And why that is important is that the research shows that people trust their doctors and feel comfortable with them. And so we want them to be able to go into that setting to receive their vaccines. If they choose to come to us, that's fine. They can be, that will be available. And vaccine over time will also be available at our local pharmacies, which will be the same protocol that we currently use when we want the flu vaccine. So for what we do in Fairfax County Health Department, it'll be on our website, and it'll also be we will have news announcements about it, so people will know exactly what to do at that time. Right now, we haven't made any announcement because there's no vaccine and there's no plans at this point to do 1C.
And that deployment to the 1C individuals will be a statewide effort, right? It won't be like Fairfax County gets to go first and then Lord, I mean, it'll just be that it'll all become available for the state at the same time.
That is correct.
Okay. And then of these, that reminds me of another question I had. These vaccines that are in the pipeline, are they all going to require 2 doses for maximum efficacy, or are some of them just a 1-dose regimen?
The Johnson and Johnson vaccine is a 1-dose vaccine, but that is still in the clinical trial phase.
Okay, yeah, because if it turns out that there are some that are more or less as effective, and they just require 1 dose, that could be better. But if somebody's going to their regular physician for a 2-dose vaccine, then they can make that second appointment for the follow-up when they get their first dose. So that would be very helpful if they could just do that with the physician that they already have a relationship with. So hopefully we'll get enough vaccines to make that a reality.
I'm pretty sure that by the time we get to 1C, vaccines will be much more available than it is right now, and that the private physician community will have access to it as well.
Great. Wonderful.
Our next question is something you touched on a bit earlier, Dr. Addo-Ayensu, but Rhoda from Fairfax Station asks, what are some of the medical conditions that will qualify for the early round of vaccinations?
Are we talking about 1C? If we're talking about 1C, then these are adults with high-risk medical conditions such as diabetes, hypertension, chronic liver disease, lung disease, kidney disease. So it's the usual high risk chronic conditions that tend to be in the elderly. Obesity is one of the risk factors for severe for possible complications from COVID. And so individuals with all of these conditions will be recommended when we are in phase 1C to receive vaccines. And then we've seen also that adults 65 years and older also at risk for more serious disease from COVID. So they are also part of phase 1C.
Great, thank you. That was helpful. Our next question from Richard from Chantilly, and Richard asks, what, if any, timeline is available or estimated for who and when the vaccine will be administered? I think you answered that. Richard also asks, will it be free or is it something we're going to have to pay for?
That's a good question. In terms of payment, there should be no out-of-pocket expenses borne by anyone in the United States for COVID vaccines, because as you know, the federal government has invested heavily in these vaccines, and so it should be free to individuals. However, if a person has insurance, a healthcare provider can bill for administrative costs for administering the vaccine, but it shouldn't have to come from the patient. It's just something they can submit to insurance after the individual has left.
Right, and I just want to reiterate that there will be no out-of-pocket costs for anybody. That's one of the things that we included in the CARES Act, and we're including in the relief legislation that's pending into the new year. And that even if you're insured and there's an administrative cost that's charged to your insurer, there's no out-of-pocket payment for you. And for the uninsured, there would be no out-of-pocket costs as well. There's CARES Act dollars and taxpayer dollars will pay for that. So excellent question though.
Our next question comes from Will from Winchester, and Will asks, what are you doing to get us stimulus checks in the next relief bill? Well,
that's one of the things that we're fighting over right now. And originally the folks in the Senate did not want to have any stimulus checks at all. They have come to up to $600, which I still believe is completely inadequate. I think that we need recurring checks. I think that we need at least $1,200, but we're fighting for it. But again, this is compromise legislation, so nothing's agreed on until everything's agreed on. And we're not leaving for the holiday break until we have relief. So I'll be back on the Hill tomorrow, Sunday, for another round of votes. I hope that we have a deal by then, but if not, we're going to have to pass another extender to ensure that we keep the government funded, and then hopefully we'll get something before the holidays. But nobody's going home until we have a deal. So there's a lot of really motivated people on the Hill, and we will keep fighting for it. And stimulus checks right now are a part of it, but it's still not going to be enough, unfortunately.
Great, thank you. Our next question from Eileen from Ashburn. Eileen asks, Representative Wexton, what is the status of your bill HR 8457? Are its provisions now included in the National Defense Authorization Act? She says, if so, when the NDAA funding becomes law, will the government federal employees still be able to restore our 2020 use it or lose it annual leave that we forfeited during this year during the pandemic?
Okay, so this is kind of a niche question, but it affects a lot of my constituents, and it's about use or lose annual leave. And so many of our, Dr. Addo-Ayensu and I were talking about the fact that we're working basically 24/7 nowadays, and we're not alone in that. I know so many people are, and so many of my federal employees are doing the same thing and haven't been able to take leave, their annual leave, and they should, but meanwhile they earned it. So my HR 8457, which would allow rollover of that, hasn't moved, but I have good news because I did include an amendment in the NDAA, which would allow another 60 hours of annual leave to roll over. So instead of being 240 hours that they get to roll over, it would be 300 hours. So for those federal workers who are looking at having use or lose leave that they're going to lose, you can carry up to 300 hours over into the new year. Now, that's in the NDAA. The president has threatened to veto the NDAA. It passed both the House and the Senate with the National Defense Authorization Act, is what NDAA stands for. It's a very important piece of legislation that authorizes and helps fund our military service members and many other defense needs. The president has indicated that he's going to veto it on a completely unrelated note, on something about the FCC basically, and his basically feud with Twitter. Has nothing to do with our soldiers and our people, our folks in uniform, but that's what he's threatening to do. It's already passed both houses with a veto-proof majority, so we may have to come back if he does veto it and override that veto. But as of right now, it looks like you'll be able to carry over 300 hours. So there you go.
Great, thank you for that. Our next question is from Donna from Ashburn, and Donna asks, with the recent adverse effects shown of allergic reactions to the vaccination and the different strands reported where a vaccination would have to keep up with the current strand, why can't it be considered like the flu and let businesses get back to operating as usual and request masks be worn?
Well, I'll let Dr. Addo-Ayensu talk about how it's not like the flu. But my understanding is, we've had mask mandate in Virginia for many months, and still being transmitted, and it's extremely contagious. It's very hard to block all of the virus from happening, and I don't think we can get back to business as usual unless and until we get some immunity in the community. I know that there have been a couple adverse reactions, but very few is my understanding. I know that the vaccine is really considered very safe and effective. But I'd like to toss to Dr. Addo-Ayensu to talk about how this is different from the flu, and how many of those adverse reactions we've observed, and what are who are the individuals who seem to be susceptible to them.
So I sort of missed the question when it was originally being asked.
Justin, but can you repeat it?
Absolutely. So the question was, with adverse effects being shown of allergic reactions to the vaccination and the different strands that are reported where a vaccine would have to keep up with the current strand out there, why can't COVID be considered like the flu and let businesses get back to operating as usual with just a mask mandate?
Okay, so in terms of the flu and COVID, they really are not the same. We do have animal influenza vaccinations. It's not because of the vaccine, but the fact that the flu viruses change. And so we try to keep up with, we try to anticipate what the next flu virus that is going to be circulating is going to be like. And in advance, we do make vaccines to protect us. Sometimes we are closer in terms of a match, and the vaccine is more effective than other times. For right now, we don't know. We're still learning about the flu. We're still learning about COVID, and we haven't seen it as a virus that evolves as quickly as the flu virus does. But what is different is that we don't know, we're still learning about the vaccine, how long immunity will last, for example, and whether individuals will have to be vaccinated routinely, and if so, what is the frequency, and so on and so forth. That is something that we're going to be learning as more and more people get vaccinated and as time elapses. Why we need to continue to wear a mask, is that what I heard, the other half of the question?
I think the viewer was asking, why can't we just wear masks and not have to take a vaccine?
So we are dealing with a novel virus, one that none of us have immunity against, and are all therefore susceptible. Only people who have been sick with COVID are immune. And the only two ways to gain immunity: either you get sick and hopefully you recover and develop your immunity that way, or you do it through vaccination. We will never be able to live our lives the way we used to live, which was prior to 2020. Even though we had influenza that came every year, we had that level of normalcy because that was a virus that many of us had some level of immunity against. Even though that immunity changed because the virus was changing, there was some level of immunity that the majority of individuals had. With this virus, very few of us have immunity. So the seroprevalence survey that was done for Virginia, for example, shows that only about 8% of Virginians have antibodies towards COVID, which means that they've been infected with COVID at some time in the past. The flip side of that is that more than 90% of us do not have antibodies to COVID and therefore are susceptible. And if we don't find a way to become immune through vaccination, then the only alternative is through illness, which, as we've seen, can be very detrimental for a significant portion of our community.
Yeah, no, thank you on the illness one. Now, can you speak very briefly about your understanding of the adverse reactions that people have had to the vaccines and what we've seen? I mean, I don't know if you've seen anything in Virginia about people having adverse reactions, but anecdotally, what I've heard from people who have it is that they haven't had any adverse reactions, and that's why they have them stick around after getting their vaccination, just to ensure that
You're absolutely correct. So I'm not aware of any adverse reactions in Virginia, but we've heard of adverse reactions in some people in the United States who have gotten this vaccine. The usual side effects, which we wouldn't even call adverse, but the usual side effects has been maybe some pain at the site, some muscle aches and sort of flu-like illness that is short-lived. And then we've heard of some people who have had more serious side effects or adverse effects like the anaphylactic reactions and so on. And as you pointed out, that's why people are being asked to wait 15 to 30 minutes after they receive their vaccine to make sure that they're going to be fine. A lot of these anaphylactic reactions tend to happen immediately or soon after you receive it. And so it's important that we kind of keep people there at the site, at the clinic site for a while. There is a vaccine adverse event reporting system, VAERS, that has been in existence for forever, that individuals that have adverse events to vaccines can report to. So it can be either individuals or physicians can report into that system. I think there's a new one as well that's out called VSafe that also specific to COVID, that individuals can also report adverse events. And it's important that individuals do this reporting, because that's how we're going to, understand the real spectrum of adverse events out there that could come about as a result of receiving COVID vaccine.
And the vaccine, the Pfizer vaccine is not currently indicated for people who have had these kinds of reactions in the past. Is that right? People who carry EpiPens who have very drastic reactions to, say, peanuts or bee stings or whatever it may be, that the vaccine is contraindicated for them. Is that correct?
And yes, and it's important to speak to your private physician about that if you have a history of these hypersensitivity reactions.
Gotcha. Very good.
Our next question comes from Lewis from Loudon, and Lewis asks, I would like to know if the following the upcoming stimulus package that's currently under discussion does include an extension of unemployment benefits, specifically for those covered under the PUA program under the CARES Act, which would cover independent contractors, gig workers, and such for unemployment benefits.
So that is the PUA plan was something that was included in CARES, and for the first time, gig workers, independent contractors were able to be covered under state unemployment insurance schemes and under state unemployment insurance regimes, and that is expiring. That is including that as something that is in the compromise legislation. That would be included and extended. So my hope is that we'll be able to do that along with and it would be a $300 plus up as well per week. And so that is something that is included in the compromise legislation. I'm not aware of anybody trying to take it out. I think that that's something that was very well received and really necessary. So my fingers are crossed, but I feel good about the fact that it will be included in the compromise legislation.
Great, thank you. We have a question from Facebook next on the comment section. And someone asks, is it true the vaccine will not be effective for a long period?
We don't know yet. That is a question that researchers will be looking at. We just don't know yet.
So do we know at what point after receiving the vaccine you start to have the antibodies that are circulating and things like that? About I mean we may not know what level is sufficient, but
no. So we do know that this is part of a trial. So we do know that people 94-95%, depending on the vaccine, of people have antibodies that are acceptable and protective. But for how long, we don't know. Antibodies typically are produced about 2 weeks after you receive a vaccination. So within 2 weeks, the antibodies kick in to a level that is protective. Now, the duration of that protection is what is unknown at this time. So as you know, there's some childhood immunizations that we got, and we don't have to, keep having booster shots like we do with, for example, flu vaccines, where we have to do it every year. So that's what I'm talking about in terms of how long this protection would be for, and what the recommendation will be in the future of repeated boosters in future.
So it sounds like the best thing that we can do is get these vaccines deployed as quickly as possible out to the entire population, and in the meantime keep practicing our mitigation strategies and hopefully knock the virus out, like whole of society approach kind of thing.
Absolutely. I mean, the first step right now is to develop some level of immunity against this vaccine. Because right now, against this virus, because as I said, right now, in excess of 90% of the people in Virginia, and for that matter, probably the rest of the United States, are susceptible to this vaccine. And we can't hide away from it. It's not going anywhere. So if we want to begin to think about how we get back to the life that we were living prior to COVID-19, vaccination is going to be a critical part of it. Or the flip side will be that we continue to wait out for a long time until we have reached herd immunity through disease, which I think all of us will agree is unacceptable.
Right. Yeah. No. 300,000 plus dead Americans is already too many. So,
Yes.
great. Do you have any more questions, Justin?
We do. One more here comes from Rebecca from Manassas. Rebecca asks, what can be done to assist people who have lost a job, including those of the restaurant industry, with paying rent and utilities while the industry has been hit so hard?
Yeah, the hospitality industry has been absolutely decimated by this pandemic, and the compromise legislation does include another round of paycheck protection program money, which is going to be targeted really mostly to those businesses who need it most. So that includes things like entertainment venues and live entertainment venues and people in the restaurant business and hospitality business. So that's one thing. Also, the pandemic unemployment assistance program will be extended, as well as extending those enhanced benefits. But it's rough. It's rough out there, and we understand. And so I certainly understand your suffering and your pain. Another thing that we're doing is making sure that we have programs for rent assistance at the state and local level. Virginia has programs. Every locality has a program from the CARES Act money. We need to make sure that we extend those and extend the eviction moratoriums as well. And that's something that we're trying to do in this compromise legislation, which I'm really hoping will pass in the next few days. So we're fighting for it, but know that help is on the way.
We actually just got a follow up to that question on Facebook, asking, is there help for landlords who are expected to shoulder the burden of some of these?
Yes, the compromise legislation includes rental assistance, which would go to landlords to help defray a lot of the expenses that they're facing when people are, because you can't just have an eviction moratorium and not have any relief for landlords who still have their own mortgages to pay and their own notes to pay. So this would include money for landlords and for those who are the mortgage holders on those premises.
Great. And then I think one last question that we have from Facebook before wrapping up here. With the holidays coming up, what are the best practices to keep ourselves and keep our families safe?
So as we see cases and hospitalizations and deaths continue to rise across the United States and here in our community, the safest way to celebrate the holidays is to celebrate at home with people who live with you. And this is because, gatherings with friends and families who do not live with you can increase the chances of getting or spreading COVID or even the flu. I know that, the pandemic has been stressful and isolating for many people. However, we need to find new ways of honoring our holiday traditions this year. Travel and gatherings are higher risk than staying at home, and celebrating with members of your household is also better than celebrating with people who don't live with you. So it's about risk and minimizing risk as much as we can. Participating in large gatherings is riskier than doing so in small gatherings. Congregating outdoors is safer than indoors. And whatever you do, people should remember to stick to the public health measures that we've heard over and over again. Require your guests, please, to wear your masks if gatherings include people of different households, except for when you are eating or drinking. It is also important to remember to stay at least 6 feet away from the people who are not in your household. And, as if you're having many people come, you need to clean and disinfect your high contact surfaces and encourage frequent hand washing. So it's the same messages we've heard before, and I hope that we will practice it consistently and correctly, and hopefully have a safe and happy holiday season.
Thank you so much, Dr. Addo-Ayensu. And I would just add that, we were already seeing increases around our region from people gathering at Thanksgiving. And we don't want to see that happen again into January. So just, there is light at the end of the tunnel with these vaccines being deployed. So just be patient, stick with your core family unit, and have a Zoom Christmas. And then next year we'll have a wonderful 4th of July and a great Thanksgiving and Christmas, back to normal, hopefully. So, well, thank you so much, Dr. Addo-Ayensu, for joining us today. That was really informative. I learned a ton about what's happening out there. And thank you all for joining us at home. Please, please have a great holiday season, and please stay safe. Take care.
Thank you.